My name is Jana Stewart. I'm a wellness coordinator here with PHS. I mostly support schools in Washtenaw County and sort of mid-Michigan, and I manage our volunteer program. I'm also a really big nerd for school gardens and farms, because having been a former farmer and gardener. So if anyone has questions about school gardens later, catch me at one of the breaks. I'd love to chat dirt with you. So before we get into the nitty-gritty of sort of what is policy, systems, and environment, I just want to ask a few opening questions about why some people chose to sit where they're sitting in the room right now. So the tables, people might have noticed, were decorated a little bit differently. Some of them have colored pencils and markers and coloring pages. Some people have little mustache selfie things. Some of you have nothing. Does anyone want to share why they chose the seat that they're sitting in?
Sure.
Yeah.
I sat here because when I came in, there was only one person here. And
So you wanted to sit next to people?
yeah, well, some other tables had at least two.
Okay. Yeah, does anyone sit where they're sitting because they wanted to sit with a friend or they came with someone? A few people? How about my people who had no choice where they were sitting because they were one of the last few in, right? Okay. So that's just sort of a basic demonstration of how in any space that you're in, that you're working in or living in, you're constantly being influenced by your environment and by policies that sort of push or nudge you in different directions. So today we'll sort of talk about what each of those things are and how they apply to your school. Hopefully you'll walk away with some examples of ways that policy, system, and environment can influence your school in a positive way as opposed to a more negative way. I have sort of a few unhappy examples up here as visual aids. You know, a lot of people might have policies about fundraisers or a lack of policy about fundraisers, such as bake sales. Food access is a big one, the types of foods that are available in our environment. And that's something that influences us not just in the school building, but as we move through our environment in our homes. Do we live in an area where there's ready access to fresh food? Or do we live in an area where you have to drive a significant amount of time in order to buy fresh food? Those are the sorts of things that we'll be talking about today. You know, safe streets, all that jazz. So I want to review first, I'll go about defining these systems and environment, what each of those three things is. And then I'll sort of show some assessments that are available to you to help you identify how you're doing in each of those areas, as well as some other resources such as funding or other programs that can help you to pursue a PSC initiative if you want to in your environment. So I'll begin with the health impact pyramid. Show of hands if you've heard of this before, seen this before. A few of you. Okay, and I know that it's kind of impossible to read in the back, so I'll just read the different sections. So at the base of the pyramid here we have socioeconomic status. So things like income, geography. You move up and it says changing the context to make individuals' default decisions healthy. And then you have long-lasting protection interventions, clinical interventions, and then counseling and education is at the top of the pyramid. So the idea behind this pyramid is how can we have the greatest impact when we're doing a public health intervention or initiative, and you have the greatest population impact as you move towards the base of the pyramid. So at the base of the pyramid, if you have interventions that are focusing here, you'll reach the greatest number of people. As you move up the pyramid, it gets a little bit more individualized, and you also are increasing the effort needed by that individual to make that healthy change. So whereas if we were at the top of the pyramid and we provide an individual with education, like we do with our PHS lessons, we're putting the ownership on that person, on that child, to make that behavior change. Whereas changes at this level make healthy decisions the default decision. So when they walk into their cafeteria, for example, are they given a healthy thing without even having to think about it? So that's sort of the idea behind policy, systems, and environment, is that these are changes that are making the healthy choice the easy choice without people having to really put that much effort into it. Some other examples of different levels of the pyramid. So that long-lasting protection interventions, those would be things like putting fluoride in water or doing immunizations. Clinical interventions, those are things like medications or clinics. And then PSC is the blue level. Obviously, a lot of our program focuses on education, so we're at the top of the pyramid as well. Show of hands if you've seen the Socioecological Model before. A lot fewer. Okay, so this is really the model that our program is based on. The idea behind this is a behavior change model in public health, and it really just defines that there's multiple layers that influence our behavior every day. So it might be our own personal knowledge and skills. That's the individual level in orange. It could be your interpersonal relationships. So what are your family doing? What do your friends do? And how does that influence your behavior? Organizational level, what sorts of rules, regulations, habits are there at an organizational or institutional level that are influencing behavior? The green is the community, so what sorts of resources are available in your neighborhoods, in your school districts that can support healthy choices, and all the way up to public policy. So the things we were just talking about in terms of what's going on at the state and even the national legislative level that sort of influence behavior. So the socioecological model, the idea is that you want to be creating change at every level, not just one. Because one program, if you're focusing on the individual, might meet some people or work with some people, but it's not going to reach everyone. So the idea is that you try to flesh out what you're doing in order to reach all the different levels. So our program really does focus quite a bit lately. This is where our educational lessons would be. So interpersonal level, that would be like the parent packet. Does anyone use the parent packet? I wish there were more hands. The parent packet is great. The parent packet has a statistically significant difference on behavior change in our kids. We've looked at this. Students who take home what they learned in their lessons and share it with their families. Although all students that are exposed to the educational lessons have measured improvements in their behavior, the students who take it home to their families do vastly different than everybody else. Yes?
They find it on the portal, right?
They can find it on the portal, yep. Under that education tab, there's how your lessons are kind of down the left side. Just below that is the parent packet. So you could send that home. Students basically interview their parents and share what they learned. It's a really great tool. Could be a homework activity if you chose. Organizational and community. This is the PSC initiatives that we'll be talking about, as well as a little bit here. So hopefully it'll be helpful. Okay, so can anyone give me an example of a wellness initiative that they've done that you think might be a policy, system, or environmental change, as opposed to just kind of an event? Anybody? Yes?
We put into our wellness policy that students were not to be withheld from PE or
Okay.
recess because of behavior issues.
Yeah. Okay. Yeah, in case anyone didn't hear that, that was their school added to their school wellness policy that you cannot withhold recess as punishment. That's great. Any others? Yes, Paula.
We suggested that at class parties, they offer some healthy choices instead of all candy and cupcakes.
Okay. So providing staff with and parents?
At class parties.
Okay, at class parties, having recommendations for healthy things. Right, so these are all on the policy, systems, and environmental side. When you're out in your school, yes?
We have a cooking class for our fourth graders to teach them, how to make healthy choices in terms of, bringing it back to their families and learning how to let the moms and dads know this is what we learned in class and how to cook healthier choices.
Okay, so you've sort of incorporated a class. There's sort of access to food there. That's an environmental change as well. So a lot of the work that we do as part of our wellness initiatives do focus on the individual, and they tend to be more events like apple tastings, or in this picture here, students made signs and decorations that had to do with the healthy goals. That isn't to say that these aren't important and that they're not impactful, because they are. Again, we want to focus on all the different levels of the socioecological model. We want to focus on the individual. We want to help the community get to know each other, all that. So it's not that the programs and events aren't good. It just means that programs and events on the left side, those tend to be sort of one-time things. So they're creating short-term change. And they're not generally part of an ongoing plan. When we look more at policy, systems, and environment, we're looking at things that are ongoing growing, that can create long-term change, that focus on the community and population level. So they'll be impacting more people without as much effort required of you planning it or by the individual that's doing the behavior that you're seeking out. So as we're going through the Project Healthy Schools steps, it's really not possible to do PSC initiatives without taking the time to do steps 2 and steps 3 really well. It's not sort of something that you can decide randomly, I want to do this PSC initiative. It really is something that you should be taking stock of what's happening in your environment through assessment, having a discussion with your wellness team to identify ways that you can purposefully make change, and then creating a plan in order to do that. So PSC is something that you should be sort of revisiting every year in a cyclical sort of way, and trying to find out ways that you can promote health throughout your environment. So environmental initiatives really just refer to the physical built environment, changes to the social environment, and then one we didn't hear is the economic environment. So that's a big one too, and we'll talk a little bit more about that in a little bit. I'm going to start actually with food access, because that's a really big one. So as part of our program, everyone does a cafeteria assessment using the Smarter Lunchroom Scorecard. This is one way that you can identify changes that you can make to the built environment in the cafeteria. And that has to do with things like, well, first of all, is there actually access to healthy fruits and vegetables in your lunchroom? But it's also more subtle things like how milk is placed within a cooler. So if you have white milk sitting in front of the chocolate milk, children are more likely to pick the white milk than the chocolate milk. If you have a food service person behind the line who is kind of scooping whatever the hot lunch of the day is, if they're using language such as, which vegetable would you like to eat today, as opposed to, would you like a vegetable today, students are more likely to have a vegetable, because kind of the way that the question has been phrased is getting them to put it on their plate. So there's sort of really subtle things in that scorecard that can help identify areas in the environment of the cafeteria that can help promote healthy choices. So this is without even changing or working with food service to get rid of pizza. This is things that you can do on your team that will sort of nudge students in healthier directions without you really having to go to war with anybody. What? If you just go on Google and search Smarter Lunchrooms, it'll be the first thing that comes up. That scorecard was actually developed by professors at Cornell University and is now used fairly nationally. It's seen as a really useful tool. This is just some statistics about, oh yeah, I have a pointer. Some statistics about some of the different ways the scorecard can help improve behavior, and I know people can't read it, so I'll just read a couple. So this one here says, giving healthy food choices fun descriptive names, for example, calling green beans supercharged green beans, can increase consumption by over 30%. This one here says offering sliced fruit can increase student consumption by over 70%, as opposed to giving them a whole apple or a whole orange. They're more likely to take it if it's been cut up and put into little cups. So that's just some of the examples that will come out of doing the Smarter Lunchroom Scorecard. And your champion or your PHS coordinator can help you complete this assessment. Another tool that's available for you is the HSAT Healthy Eating Assessment. So I know some people in this room have completed the HSAT Core Assessment. This is one of the topic area assessments that's also on that dashboard when you log into the HSAT website for the first time. And then I wanted to point out some additional funding and support that might be available if you are trying to make a change to the built environment in your lunchroom. Fuel Up to Play 60 does have equipment grants for the kitchen. So if it turns out that it's difficult to provide your students with healthy breakfast because they don't have any cooking equipment or knives or cutting boards or smoothie blenders or whatever, Fuel Up to Play 60 is another resource for funding in addition to us. MSU Extension has a community food systems team, and their whole job, they're all assigned regions throughout the entire state, so all of you have a person assigned to your area. Their whole job is to go out to schools and hospitals and help connect them to farmers. So if you wanted to do farm to school or you wanted to start a school garden, these staff will come out and help you for free, help you set up a garden space, help you interview farmers, or even connect, they'll help your food service director connect with farmers so they can make farm to school purchases as well. And then the MSU Center for Regional Food Systems, they they oversee the Hoop Houses for Health program, which is another farm to school initiative. So the idea behind that program is that farmers have applied for grant funding to install an additional hoop house on their farm, and they pay off the loan by giving away food donations to a school or a hospital. So schools that participate in the Hoop Houses for Health program get free fresh fruits and vegetables from a local farmer. So that's a really great program. What?
H or C?
Hoop Houses, H.
H.
Yep. Yes, okay. Other physical built environment changes that we can make have to do with kind of our PE and physical activity access. So again, HSAT has a number of different topic area assessments that could help you come up with ways that you could improve that situation at your school. There's two actually, the physical activity and physical education assessment, as well as the safe school environment assessment. I believe the safe school environment assessment includes things outside of the building, so the sidewalks, lighting, as well as things like water, access to clean drinking water, and things like that. Some other additional funding and support for making changes to that topic would be the Michigan Safe Routes to School grant. So they have both a mini grant and a large grant that you can apply for to install additional signage for pedestrian safety, fix actual sidewalks. Clay, you did that, right?
Yes.
Several years ago. Fuel Up to Play 60 also provides PE equipment, good equipment, that's the website, Good Sports Equipment, I believe. They have grants for sports equipment. Surprise, surprise. I think they might also have some of the kinesthetic classroom materials, so like these crazy chairs that are kind of active. They're good, a nice alternative to fidget spinners, I think. Keep kids a little bit more engaged without them, throwing around. Yes? That's called the Hokey Stool.
Can you spell that?
Hokki. And then Delta Dental Foundation, this grant has since closed, but I think it will be a yearly thing. They have a grant for water bottle filling stations, and it's a really, really easy application. So it's really teacher friendly because it has fewer questions than a lot of grant applications do, which is kind of nice. So we'll put up on our portal, we'll announce grants, so please do visit the portal and look for announcements because we do put out grant opportunities on there, and we'll update you if this opens up again next year. Any questions about this one? Okay. So the social environment, this again, I mentioned this was about the relationships and cultures that are going on in your school. So things like social norms, power structures, institutional habits, religious beliefs, these things all influence the choices that go on in your building. But they're also really dynamic. They change over time. This is a kind of overlooked area for environmental change because it's kind of challenging. But I think one good example of ways that you can change social environment is to pursue student engagement, and that's something that a lot of teams that I've worked with wish they did more of anyway, so you're kind of killing two birds with one stone. This, I know you probably can't read it, but this over here, this little poster, was designed by students for a student health campaign. It says fact, and it's Dwight Schrute. Does anyone watch The Office? Get that? Okay. Fact, 9 out of 10 Weston High School students choose non-alcoholic drinks when they hang out with friends. So it's just an example if you wanted to have a student advisory team or ask your student council to design a campaign for your school so that they're the ones promoting to their peers in their own language in a way that's going to be appealing to that age group. You could ask them to design health materials for your cafeteria. You could ask them to come up with the next wellness initiative that you'll be doing on your team. Those are sort of ways to get students more involved so they start influencing the norms of their classmates, as well as really giving them a good opportunity to be civically engaged, if we're being honest. There are 2 assessments on the HSAT website that address social climate and can give you some great ideas for how to try other things. One is the staff wellness assessment. So social environment isn't just the students, it's also the staff. If we're having problems on our school environment, it can be really hard to get people to buy in, right? Has anyone ever struggled with people not wanting to support an initiative, or they've come back and said, I don't want to do that, I don't have time? get out of my, yeah. Oh, I know some of your stories, yeah. Right, that can be a big challenge. So having staff wellness initiatives, and that's been a big push of our program recently, that's to help move the emotional climate of your staff in a direction that's going to be helpful for healthy habits. So we want staff to feel like this program isn't just another thing on their to-do list, it's something that can also help them be healthier and help them really be a model for their students. So that's one assessment. And the other is the social and emotional health assessment. So that can be good. And then the last one for built environment, or for environmental change, is economic. And this is one that we didn't have any examples about. So this has to do with how financial incentives or disincentives can encourage certain behaviors. So for example, if we have a school concession stand that sells salads or healthy chips or apples or fruit or whatever for a higher price than the unhealthy items, what are students going to buy? The unhealthy items, right? Just like adults, it's the same thing. So the way that you sort of structure the economic environment in areas where you actually have control over that can help produce healthier behaviors in students. So one example would be to have higher prices for less healthy items. PTOs are actually really fond of that because they make more money because the unhealthy items sell really regularly and they're getting more money if they're charging more for it. That's another way. You could also work on connecting with community resources to bring in programs at a reduced rate. So if you live in a school district where it's a real challenge for your parents and your students to either purchase fresh foods or pay for a gym membership or be a member of some club, since you have us as a partner, we will help you reach out to those community organizations and try to bring that in at a reduced rate. So Weight Watchers would be one example that we're thinking about doing in the future, is bringing in Weight Watchers to be available to your staff at a reduced price. We can try to do the same thing for you in terms of gym memberships. Sometimes we've brought in physical activity instructors to do classes on site at the school after school ends, so that staff can have access to physical activity without having to pay for a gym membership, but they can still take a yoga class or a circuit on site. So those are some examples of ways that that we can hopefully make it a little bit easier, because I know sometimes the healthy choice is really seen as the more expensive choice, and that shouldn't be the case. We don't want anybody to be priced out of being healthy. That's not fair. Okay. So now we're on to systems, which is really a more nebulous one. Systems really refers to organizational procedures or rules, but it works really hand in hand with policy. So people often mix up systems and policy. Think of policy as the thing that's written down, and systems as the thing that's just like the rule or the structure or the infrastructure that's in place that supports it. So systems and policy should be in the same direction. This comic is sort of making fun of the fact that there's a policy, but there's no system to support people actually following that policy. That's a pretty common thing, I think. We're all required to have a school wellness policy because we receive free and reduced lunch reimbursement from the state, but how many of you have read your school wellness policy? A few of us. A few of us. Right. So there's not really, systems are the way to sort of bridge that gap a little bit, and to have rules in place that are supporting the wellness policies that we have written down someplace in a book that nobody reads. So policy is similar to systems in that it's kind of a set of rules or guidelines, but it's formally written down. So policy is an area that hopefully you'll feel more confident being more engaged in following Matt's training about advocacy. Really, you are the only person in your school building who is empowered to make those policy changes. I mean, who else other than the wellness team has the power to change your school bake sale policy or your PE and recess policies? I hope that you'll take this back to your wellness teams and sort of push for a little bit more change in that arena, because it can impact a lot of people with very little planning on your part other than, like it's not a continuous event that you have to do. Once you have the policy and you share it out with all of your stakeholders, it's there. And it's just like the Estabrooks example of the unhealthy stuff. Okay. So policy is also a big one for food systems, obviously. We all, I think, battle with the lunchroom choices, and I'm here to say that that is challenging for us as well as professionals who work in this space all the time, because there's a lot of there's a lot of things going on, and it's a really complicated issue. But I do think that even though we might not be able to control what Congress calls a vegetable, we can still change policies around things that we personally in a school are selling. So concession stands, vending machines, school stores, that's something that you can kind of get around and have some more control because they're not regulated by the same people. Those are your stores. I don't think any of us should have school stores that only sell donuts. That would be bad. We don't want that. So as I hope you'll go back and be spokespeople for policy in your school as much as possible. I'm between you and like lunch, I think, so I don't know, I'm gonna move on. So I just have a couple examples just to run through to give you some ideas of how policy, systems, and environment could look for a few different examples. So the first is healthy fundraisers. So creating school-wide healthy fundraising standards. One policy you could do would be to adopt the Smart Snack Standards, which were developed as part of the Healthy Hunger-Free Kids Act of 2010. So there's already built-in recommendations for healthy items as part of that policy language. You could adopt those. You could adopt or change the school wellness policy about which products are permitted for fundraisers. Any others for policy? Okay. A system change could be develop an approval process for fundraising activities and inform all of your stakeholders, such as staff, teachers, parents. Another could be to have a pre-made list of recommended products that people could choose to offer, and include that information in your school's welcome packets that you provide to parents at the beginning of the year. And then an environmental change could be, again, asking your students to be more engaged. So you could ask them to design some signage to be put up throughout your building that markets healthy items and healthy products that can be up throughout the school day. Okay. So another area is after-school physical activity. So some different ways we could change policy, systems, and environment to provide more structured physical activity for students. A policy example could be creating a joint agreement with your school administrators and community organizations that allow the use of school gyms to be used after school hours. That's a pretty popular one. So basically having like rec and ed or outside community org athletic classes offered at your school building in the gym. One system change you could do would be to develop a screening process to identify students and families who could use some additional support for things like that, and connecting them to area resources or community orgs that have sliding fee scales. So that's more like a combination of an economic environmental change, but also a systems change, because you have a set of procedures in place that help you identify those individuals and connect them to something. So that's a system change. And then another environmental change you could do would be to write a grant to purchase additional equipment or resources and offer those, make those available for use after school in open gym or something like that. So. Are there any questions about this topic? Not this topic, but like the topic of policy, systems, and environment. Yeah.
What is the current state, federal laws on what you can sell / serve in schools? Weren't we somewhat bound by that? Has that changed?
Yeah, if they're sold by your food service provider and you receive state funds for free and reduced lunch, there are regulated requirements for that.
But if you have a fundraiser?
If you have a fundraiser, bake sale, if you have a school store that's just operated by staff and students, it's not regulated.
Okay, so your snack line operated by your food service does fall.
If they have free and reduced lunch, yeah.
Okay.
And vending machines, right?
Yes, that includes vending machines. Yep. Yes.
So if I wanted to change something that's being served in the lunch line, do I have any power over that?
You do, in the sense that most people's food service provider is there under contract. So if their constituents are unhappy and you are vocal and you advocate that you're not happy on your students' behalf, especially when you come up to the end of the contract in your school district. For example, Ann Arbor's contract is ending soon, and so we can put out a bid for people to, put in to do a better job. So that's one option. Another is to, oftentimes when you're working with food service, they don't want to serve unhealthy things. They're not bad people. They are working in an environment that's challenging, that has very limited resources. When they're getting reimbursed between $1.50 and $3 per kid per meal, that's not a lot to work with. So at least when I go in and meet with food service, I usually offer to help them with something so that there's sort of that reciprocal feeling in the relationship. So it could be offering to connect them with PTSO or helping to recruit volunteers so that they can do more of those kind of made-to-order fresh things or do more tastings, because often their limitation is money and staff, because it's really hard to find enough staff to work in the kitchen.
On your wellness committee.
What?
If they're included
Yes.
in your wellness committee.
Yeah, if they have a place on your wellness committee, they're going to have a lot more buy-in, because they're going to feel like they're part of the conversation, not someone that you're just coming to and saying, we don't like what you're doing, do it differently. So it's that kind of, you have to kind of tread lightly, I would say. Any other questions?
We were just discussing
Yeah.
that fundraisers, all schools need money,
Right.
so we should start with the legislators first, but because these fundraisers draw in so much money,
Yeah.
ours is a Krispy Kreme donut thing, school-wide, and it just like, it crushed our whole initiative but it's how do you,
I
Yeah.
appreciate that, don't get me wrong.
Yeah.
Not having to speak Koreans up north.
I mean, we earned $6,000 on it, and it wasn't
Yeah.
that much work. It was quick, and our principal wants to have another one in February because
Right. Yeah.
it's money for field trips. It's money for
Yeah.
things teachers want to do.
Yeah.
So that's our struggle, to find something that can rival that.
Yeah. I understand. Yeah, I understand the challenge, because health isn't this like, we're not living in a vacuum in schools. Just because it sells well because we all like it, because it's popular, and if the healthy choice was the easy choice, we wouldn't be here. We wouldn't be talking about these things and struggling to promote health, and we wouldn't have a rising obesity epidemic and all these things. But I do think it's important to be open to, are there other things out there that could sell well? And that might be asking students to be involved in selecting some items that are healthy and selling them at the same, selling both and seeing how they do, You never know unless you try. Yeah. Smart popcorn is popular, I guess. Okay. Any other questions? Okay. All right. Well, thank you for your attention.